Okay. Do we have it? Is that the right screen, Mary?
Yes, perfect.
Okay.
Yes. Mhm.
I just want to make sure that I'm not presenting like a picture of my dog or anything.
Mark, if you want to go ahead and get started, I will keep letting folks in as I see them.
Absolutely. Thank you so much, Mary, and welcome everyone to session 3, How a Bill Becomes a Law, part 2 of our legislative training series. I'd like to thank the Minnesota Public Health Association and the Minnesota Oral Health Coalition for partnering with us on this. It's been a great project, and I think we've brought some really good information to you, and we'll continue to do so in our next session. Um, just some reminders as we get started. Please mute your microphone when you're not talking. Feel free to be on camera if you'd like. If not, you're welcome to turn your cameras off. Feel free to put questions and comments in the chat at any time. We'll address them as we go if we see them. If we don't see them right away, please be patient. We will get to them at the end of the Q&A, and there will be time at the end for Q&A. And then lastly, if you missed the first 2 sessions, the Minnesota Oral Health Coalition has it up on their website. I believe the Public Health Association has it available on their website, and it'll be available on the Rural Health Association website yet this week. So you can go watch them all on YouTube, share them with your friends, and be happy and proud of the work that your 3 groups have done. Now I'm going to turn it back to Mary to ask her if she to read through their ancestral land statement. So, Mary, it's all yours.
Thank you, Mark. And for everyone, this is the Minnesota Public Health Association's ancestral land statement developed by our Health Equity Committee. And we freely welcome our partners to use this if they'd like as well. We ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and Anishinaabe. Indigenous people have a long-standing history and connection to the land since time immemorial and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and United States governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors and descendants, as well as the land itself.
All right. Thank you so much, Mary. All right, so we'll start with a little recap of session 1 and session 2, just to build it back to where we're at as our bill is making its way to becoming a law. Matt shared with us the branches of government, the executive branch, the judicial and legislative. So the legislative branch, they make the laws. The executive branch enforces the law and fulfills the law, implements it. And then the judicial branch they interpret the laws and they rule on constitutionality, and they also are the ones that hear cases that involve the law. So the next piece that we really want to share with everybody, make sure everybody knows where it's at, is who represents me. And like before, Dan shared this in the earlier one. Who represents me is important to put your address in on the Minnesota Legislature website. You can find out who represents you. And it's really important that you know who represents you because these are the folks that are in St. Paul. They're working for you and they want to hear from you. And one thing that I always make sure that I keep in front of my mind when I'm working on rural health issues is that not everybody in the legislature is an expert in rural health or is an expert in healthcare or even knows a whole lot about healthcare. They may come from an entirely different industry. So you guys are the experts. and they want to hear from you, and they want you to educate them on what the issues are that you're facing out across Minnesota. And then how to get involved. And I've asterisked this and I've highlighted it in green. So as we go through here, you'll see different areas that are in green font, and they're also asterisks. And these are what areas and times within this bill process that I think it's important and it's convenient and it's a good time for you, the grassroots advocates, to become involved in this process. And I'll just share a little bit about my journey to where I am today as the executive director of the Rural Health Association. I started out as a healthcare provider. I started out as a paramedic and got involved with some state associations and really took a liking to the legislative process because I wanted to make sure that my voice was out there. So when changes were necessary, or even when statutes and laws needed to be protected for the best interest of whether it be the emergency medical services field or the rural hospital world that I was working in, that the legislators understood my point of view. So how to get involved is really important. And as someone who walked around the Capitol not knowing what to do and not knowing when to write a letter or pick up the phone, it really helped for the associations that I worked with to make me feel comfortable and confident in those opportunities to reach out and it made it a lot easier to make that phone call or walk up to a legislative assistant's desk and make an appointment to meet with a legislator. It made me more comfortable. So I'm asking you, and I'm offering, feel free to reach out to any of the three associations to help you along this way. All right, so bicameral legislature, we have a House and we have a Senate. We have the People's House, and then we've got the Senate, like Dan explained, which is more of a high, not a higher body, but there are only 67 legislators, and it's a smaller group, and they run it a little more tight-shipped. We work off a biennium, so a 2-year period. We are going into the first year of our 2-year biennium next year in 25. This will be our budget year, so this is when the legislature will consider the state budget and setting it for the next 2 years. Our even years are our policy and bonding years. So this is generally when state-funded projects will be discussed, and will be bills regarding them will be introduced. There's also policy that comes through on this even year. And if you go to the basics and the fundamentals of it, the legislators will tell you that they don't want budget issues to come through on even number years, but there's generally always a supplemental budget, and it's really hard to make progress if you never have money involved. So it's difficult to do anything without any money at all. So we're always going to see a little bit of budget work done in that even year. The session convenes on the first Tuesday after the second Monday in January. So January 14th this year, the legislature will gavel in. And then on the even years, the date when they come back is set by agreement of both bodies. So the Senate and the House will get together, leadership will get together, and they'll determine when they're going to come back. So last year they came back in February. Some years they'll come back right away in January. It all kind of depends on what they're looking at for what the year is going to look like. I know that the state office building where the House of Representatives offices is under construction. So that was part of the consideration on the dates this past session, and it will have an impact on how everything happens in St. Paul, the work that's done in St. Paul. Accessing your legislator, your House of Representative member this year is going to be a little challenging. But once again, reach out to one of these three organizations. We're always more than happy to help you with navigating through St. Paul. The adjournment of the each session, in statute, the legislature may not meet in regular session after the first Monday following the third Saturday in May, so May 19th at midnight, they will adjourn. Now the governor can call them back into special session. There are our dates. 201 legislators, 134 representatives, 67 senators. Each district, like Dan shared, has 2 representatives and 1 senator. The House of Representatives, a 2-year term. That's elected every even year. So this year, of course, all of our representatives are up for election. Their leadership is the Speaker of the House, the Majority Leader, and the Minority Leader. And the conversations between these three individuals are extensive. And they are always conversing. I actually was going to put a picture up here of the Minority Leader and the Majority Leader in a conversation last year that I snapped, but I didn't do that. Anyway, revenue bills must originate in the House. Our Senate is 4-year terms, except for the beginning of the decade. So in 2030, they're slated to be up for election in 2030. So that the census on the decade won't affect the 4-year term this time, but in 2040, so they'll be up for election in 2038, but in 2040 they'll come back up for election because there'll be a new census, which will may have impacts on redistricting and the district lines. So as people move around the state and populations move, that redistricting also affects the terms of our senators. The president of the Senate, that's the person that prevails over the Senate during floor sessions, and then there's a majority and a minority leader. One thing that Dan pointed this out, that all your state agency commissioners are approved by the Senate. So the governor's office identifies them and puts them forward to the Senate, and they approve them. All right, so here we go. This is how the idea becomes a law. And like Dan shared, anyone can have an idea. And we always hope they're good ideas, which in our minds, they're always good ideas when we bring them forward. So you have an idea, you find an author. And this can be as simple as you've got a legislator in your district. Maybe they're having breakfast one day down at the cafe, or they're having an event, and or you bump into them in the hallway at the Capitol or wherever it may be, and you say, Representative or Senator so and so, I've got this great idea, or I've got an issue that I think could be solved with this kind of change. So you find an author, they believe in your idea, and they're willing to work with you to take it forward. Oh, we had a chat. Oh, there we go. Mary has put in the Who Represents Me link, which is a great tool. You can also access your federal delegation through this also. So we've got an offer. So now we draft the bill and we work with the revisor's office. So the author's going to work with you, the person with the idea. They might work with the Public Health Association or the Rural Health Association or the Oral Health Coalition. They might work with us on gathering information. They may reach out to the state agencies and ask for information and kind of how things go. And then they'll take it and work across with the revisor's office to make sure that the bill comes out in the correct form. And then it's not contradictory of anything else in statute. So that's the job of the revisor's office. So once you've got the bill and it's jacketed, now we need signatures. So your author's going to sign the bill, and they'll be your chief author most likely. But you can also have co-authors, and this is an area that I highlighted in green and asterisk because this is a really a fun opportunity when you're meeting with legislators to ask them to sign on to your bill. Now, in the Senate, there can only be 5 authors per bill, but in the House, there can be up to 35 authors. So as maybe you're meeting with your legislator, or maybe you're dropping them a note or giving them a phone call. And it could be as simple as just an email to your legislator saying, hey, Representative so-and-so, there's this bill that's coming, or maybe it has been introduced already. They can sign on to the bill after it's been introduced and ask them, hey, can you take a look at that? I'd love to see you sign on to this bill. Put your signature on this bill. It's bills that have authors, or excuse me, bills that are signed by members of both parties are always great. And we see that in healthcare a lot. Bipartisan bills are very common in the work we do because healthcare affects everybody. And we all know that. Public health, oral health, it affects everybody. So but it's a great opportunity for you to share the bill, share the idea, share the bill, and ask for their signature. Because once you ask their signature, they're going to dig into it and see if it's something they want to sign on to. The legislator submits the bill for introduction. The bill is assigned a number, and it gets the first of 3 readings. So this is where it goes off to committees and committee hearings. And that's another great opportunity for you, the grassroots advocate, to get involved, to testify. You can sign, anyone can sign up to testify. You can also submit a written testimony that goes on the record. So your legislators, all the legislators can see maybe where you personally land on an issue or how it affects your community or the people you serve. So once it's been heard, in the committees and it may be heard in one committee, it may be heard in 2 committees, it may be heard in 3, it may go back and forth between committees, but once it comes back to the full body from the standing committees, and it gets its second reading when it comes back from the committee, now it can go on to the general register, or in the Senate side, the general orders. So this is a list of all bills that have made it through the committee process and are now available for the full body to act on. The general register, all the bills and the general register must be made available to all members of both bodies and to the public. So, and this is really important, that this is the transparency, and this is for you, the constituent, that you have access to every bill. There are no bills that move without you being able to see them. We can all see what is in the bill. So really, there's no hiding anything in this process. We all get to see the bill. If you see a bill or you read a bill that maybe has something that is not great for your organization, not great for the people you serve or your community, or maybe it has something that is great, this is your opportunity up front to once again reach out and say, hey, Senator or Representative, we really like this bill. We really want you to support it, or we appreciate the support you've already shown. So once again, only bills on the general register may be considered for passage by the body. So if they're not on the general register, even though maybe they've been introduced, there were 9,000 bills introduced and only a few hundred make it onto the general register, nothing will move any further if it's not on the general register. All right, so now we'll get into calendars. We'll get into the debate process. This is the full bodies. This is both bodies. This is in the House of Representatives, the Committee on Rules and Legislative Administration. They choose the bills that are going to be placed on the calendar. So the calendar is what can be heard in the full body and what may be heard in the full body. The bills are put onto the calendar. The bills are put on the calendar at least one day before they're actually debated on in the body, so that you and I, the constituent, we know what they're going to talk about, so we can tune in. Both bodies have great YouTube sites, so you can watch everything. And I encourage you to watch everything. And it's a great way to learn. It's a great way to hear both sides of the bill. So the chief author will present the bill to the full body. So I've got a picture here of of Representative Liebling from Rochester. Representative Liebling has been the chair of the Health Committee in the House, and she's been fantastic to work with on healthcare issues. Let's say that the bill was Representative Liebling. She will introduce it to the body. She will explain what's in the bill and what this does for Minnesota. The members will debate it. Some members may support it. They may stand up and give their support to the bill. Some members may stand up and say, no, I don't care for that bill, and may offer an amendment, which they feel may make it better or may make it different. Each amendment is discussed and debated and voted on. So if an amendment is voted favorably, it will stay with that bill, and that bill will be then changed to include the language in that amendment. More times than not, amendments are voted down, so they never move forward. But amendment could turn into another amendment, and it's this process of the full body trying to get the bill right before it goes to the next step. There we go. Diane, thank you so much. The YouTube pages, I don't know, I get consumed with the YouTube videos. I've got it on all day, every day if I'm not down in St. Paul. So the amendments are offered. Some are accepted, some are not accepted. And then once there's no more amendments and there's no more debate on the floor, the bill is given its third reading. Everybody in the chamber, everybody in the body has the ability and the right to share their thoughts and to debate the bill. So when there is no more conversation to be had about the bill, it gets its third reading. And then in the House, this is when the members vote. They vote on the full bill as amended, and they vote it up or down. Now, I've got a green asterisk, and I'll talk a little bit about that when I get done with the Senate. But when they're on the House floor is another opportunity for you to connect with legislators. And I'll explain that at the end of as I talk about the Senate. So how the Senate, the whole full body works on the floor in session is a little bit different than the House. So the chairman of the Committee on Rules, so rules designates which bills come from general order and are going to be debated by the Committee of the Whole. So the Committee of the Whole is the entire Minnesota Senate. So all 67 members make up the Committee of the Whole. Members debate the bill. Once again, amendments are offered and members vote. So they vote the bill with amendments that have been voted or are adopted. They vote for the bill. The bill is then considered approved by the Committee of the Whole, and it's placed on the calendar, and then it gets its third reading. So it's just semantics of how they operate. Now, so the asterisk and the opportunity for you to connect. So if you are in St. Paul on a day and a time when they are on the floor, you do have the opportunity to go to the chamber. You can request the sergeant at arms go pull out your member and you can visit with them. So if there's a topic that's up for debate on the floor that day or that they're talking about, and you really want your representative or senator to have the information that you want them to have, or maybe there's something that came up in an amendment that you weren't able to get a hold of them, or you just want to get home to them, how this bill can affect you, that you support it, or that maybe there's a better way to do things. There's an opportunity to go to the chamber and to ask that your member be brought out. The sergeant at arms, you fill out a sheet. The sergeant at arms will go let them know that you have requested to visit with them. They'll step out of the chambers. They'll visit with you. You can ask them anything you want. You could tell them information, share with them more information on the bill. So once again, an opportunity for you, the grassroots advocate, to be involved in the process. And again, legislators love hearing from constituents versus always hearing the side of the story from maybe a lobbyist or someone else. They want to hear from the people it actually affects. All right, so the path to the governor's desk, the ultimate end to a bill is to hit the governor's desk and for the governor to sign it. That's what every bill is seeking, right? So now that we've passed a bill, each body has passed the bill. They voted yes on the bill. There are three paths it can take. So first is special orders, and this is not used a lot, but this allows the process to be accelerated. So if there's a bill that's time sensitive, that needs to move quickly, or that both bodies just feel it just can move quickly, it doesn't need to go to the committees. It's agreed upon. That it can move on its own, they'll use special orders. So it bypasses the Committee of the Whole. It may be debated, amended, and placed on final passage immediately and go right to the governor. So that's used. It's not used frequently. I think there was maybe 5-6 bills that went on special orders last session. It can, if both bills are identical, if the language is identical, if the financial impact is identical on the bills, they'll agree that the two bodies will agree that they're identical. It received a majority vote in each body, except for bonding bills. Of course, as we remember, they need a 3/5 majority. So having a simple majority will not pass a bonding bill. So if we've got an identical bill, or they've both been passed by each body, they go right to the governor's desk to be either signed or not signed. And next training session, we'll get into how the governor handles bills that come to him. Most likely, the bill will go to a conference committee. So the purpose of the conference committee is to bring together both bodies, both parties in both bodies, to discuss in a large group the differences between the bills. So 3 to 5 members from each body are put forward by the body to work together. So the House and the Senate will work together. These are usually people from the conference committee on that subject. So if it's a health bill, it'll be 3 to 5 members from the Health or Human Service committees that'll come together. They will meet. Once again, it's green asterisk. So this is an opportunity for you to get involved. This is an opportunity for you to provide written testimony. You may be asked by legislators, if you've been active in the bill and in the process and you've been providing information, they may reach directly out to you and ask you for specific questions. So the goal of the conference committee is to find compromise. So how can we move this bill forward? We've identified that it's important to both bodies. So how can we move this forward and get it passed once again back on the floor of each body? So once they come to a compromise, they agree upon the language. They put that language back together, and it goes back to the House and back to the Senate, and those respective bodies will then pass them. Most often, a bill that is compromised on has in that a bill that is compromised on doesn't generally have the debate like a bill that doesn't have compromise. But then again, there's always an exception to the rules. And then once the conference committee has compromised, they've sent it back to each body. The body has voted, approved it. Then it goes to the governor for signature or veto or to sit on his desk until it becomes law. So that's where we are on the path of a bill becoming a law. So there's a number of spots and stops along the way. There's a number of opportunities for all of us to be involved in this. This isn't something that we should ever expect our lobbyists or we should ever expect our legislators alone to take care of. This whole process involves you, involves all of us, involves how it's going to affect the community, the constituents. It's the greatest game on earth. It's the greatest process. This is representation of the people. This is your voice. And once again, back to the initial process, the initial step in this whole thing. This is your ideas, and I encourage everybody to get involved. With that being said, our next session, November 12th, we'll talk about where the governor fits into all this. We'll talk about amendments and readings and the deadlines so we can all get a feel for when this gets moving, the timing and the timeline. And then we'll talk about the omnibus bills and how it all comes together at the end of the session. So with that, I will stop my share and I will open it up for questions or comments or thoughts.
Mark, thank you very much. That was well explained succinctly. And I hope everyone who's either here today live or watching the recording later on really appreciates that Mark's words about how this is a process for all of us. The Minnesota Public Health Association, for example, we don't have a lobbyist. We do a lot of advocacy work on behalf of our members, but we also are working to train and engage our membership as the Minnesota Rural Health Association and Minnesota Oral Health Coalition are. So our power is within all of you. So we're excited, to hear about how this goes. And I will put the link for our last training session in the chat as well. But if anyone has questions, you can feel free to put them in the chat or come off of mute and just ask. We'd love to hear them.
You're so welcome, Lucy. And just in closing, Mary, I just want to encourage everyone that if your association or any group you work with has a day on the Hill, please go attend. Don't be afraid. It's a great opportunity. The Capitol complex is amazing, and it's a good opportunity to go visit. And when you walk into a legislator's office, and I learned this early, I was so scared to go to a legislator's office because they're a legislator. They're different than me, but they're not. To go and sit down and how welcoming it is in a legislator's office, and the whole process is just amazing. So please, if your association has a day on the Hill, or for any rural health association members, just shoot me a message, ask me, when I'm going to be there, or tell me when you'd like to come down. I'd be more than happy to walk around with you for a day, and just it's a great process. I enjoy it. I think you would too. So thank you, Mary. Thank you, everybody. Looking forward to November 12th.